evening. Welcome to the Pearl Report. I'm Diana Lin. A disease is considered rare if it strikes 1 in 2,000 people. Among such often dubbed orphan or neglected ailments are congenital bone disorders caused by genetic mutations. Producer Renato Reyes reports Hong Kong has no specialists or clinics for them and drugs are few, which can be hard on patients and their families. Wai Fong, aged 17, wheelchair-bound since he was 9. He has a rare bone disease, Osteogenesis Imperfecta, or OI, short for glass bone disease. His bones are so fragile they break easily, a condition caused by a spontaneous genetic mutation during his conception. It's not hereditary.
Maybe just a twist, a simple fall, they will result in fractures.
Dr. Michael To is a government orthopedic surgeon with the most experience in OI in Hong Kong, having treated 20 such cases over the years. In the past decade, Dr. To has done 4 surgeries to fix Wai Fong's multiple bone fractures, mostly on his limbs and one time his shoulder.
At the time I could walk. I slipped in the bathroom. My shoulder hit the basin and my scapula broke.
Wai Fong's mother first learned of glass bone disease on the day he was born.
3 of his rib bones, 4 on this side and 1 of the collarbones were broken. I could not accept it and asked the doctor why my child is like this.
The next fracture, around 2 to 3 years of age, there was a time when he had repeated fractures, in particular his legs.
Since then, Wai Fong's in and out of hospitals 4 to 5 times a year. In this picture, he could still walk. He became wheelchair-bound at around 9. Wai Fong developed bone deformities where he had fractures or surgeries that shocked his doctors.
This is the femur, okay, the thigh bone. You see a big chunk of bone on top.
New bones grown on his femur, 10 centimeters in length and 10 centimeters in diameter. Glass bone disease has 8 types, the most common affecting 1 in 2,000 people. Wai Fong has the rarest, type 5 OI. It strikes 1 in 50,000.
In our locality, we only identify 2 patients who have the type 5 OI. You can imagine if a large piece of bone grows inside your thigh, it is actually very painful.
My leg was always hot for years. It gradually burned over my joints. Because the new bones grew around my joints, they restrict my movements. I used to think why others could walk and run and I couldn't, but had to sit in a wheelchair. I felt like that for 2 or 3 years. As I grew older, meeting different people and having different experiences changed my attitude.
He goes to a special school for children with physical disabilities. Wai Fong's mum, Mrs. Lam, is a single mother. Her husband abandoned her and their 2 children.
His dad gave up. He couldn't accept his kid's condition and gave up on him. I'm very strong. I can accept it. The man doesn't want me. I choose my kid over the man.
Mrs. Lam gets $8,000 in welfare and disability allowance for Wai Fong, caring for her son full-time.
No, it doesn't cover everything. So he still needs financial support from, for example, the relatives.
Like the $200,000 she borrowed from relatives to renovate her house.
We had to change the bathroom door and the commode.
Dr. To treats her son for free as a government doctor, but Mrs. Lam still has to borrow money for unsubsidized treatment.
Like getting injections, urine tests, bone marrow tests at the Queen Mary Hospital, I have to pay about $15,000 to $17,000 every time.
Her daughter, who doesn't want to be filmed, has epilepsy and a hearing problem. But Dr. To says her ailments are not listed as physical handicap that warrants a disability allowance.
The government won't give me welfare money because my daughter is 18. I said without welfare money, how can I survive?
There's no cure for OI, but hydrotherapy helps strengthen Yphone's bones and muscles. Drugs for rare bone diseases are few.
We still have no medication that can make the bone normal again.
There's no incentive for drug companies to invest in medicines for a rare disease.
Because the number of patients affected would be less, much less compared to common disorders like hypertension, diabetes.
Hong Kong has no specialist for certain rare bone disorders. Maddie, age 3, and her mum, Nicole, from Australia, now in Hong Kong for 7 years. Maddie is 70 centimeters tall, the average height of a 6 to 9 month-old baby. She has diastrophic dysplasia, a rare form of dwarfism that hampers the growth of cartilage and bones. It strikes only 1 in 100,000 people. Maddie is the only such case in Hong Kong.
Maddie's very healthy, not affected cognitively at all. She does have physical differences. Who likes chocolate? Who?
No. Eat.
Lana, Nicole's eldest daughter, aged 4, is normal. Maddie inherited a gene from both her parents that causes diastrophic dysplasia.
Her thumb is turned right down. She uses her fingers like chopsticks. It's harder for her to use her hands because her fingers don't bend. What's Ginger doing? Running. Her legs are much shorter, so it's harder for her to run around and climb.
With no one to advise Nicole locally on dystrophic dysplasia and Maddie's condition, Nicole had to travel to the United States in July.
We wanted to see Dr. William Mackenzie, who is one of the most highly respected orthopedic surgeons in dystrophic dysplasia. Her spine is our main concern. So her scoliosis is significant, and it is right in the thoracic region, which is where her lungs are. So it can affect the function of the lungs. She will need some kind of spinal surgery to correct that.
Most likely in a public hospital here, where it's virtually free. So are government clinical geneticists. Nicole brought Maddie to see one, but he had no experience in treating dystrophic dysplasia.
Even for us, clinical geneticists, for individual disease, we do not have a lot of experience. Hi, Nathan. How are you?
Brian Chung is only one of 2 clinical geneticists in this city.
It is estimated at around 1 million population, there should be one clinical geneticist.
They're the first stop for children here with rare genetic diseases.
We would be providing the first initial evaluation and the diagnosis, genetic testing, genetic counseling to these patients.
The next step is a retinue of doctors from different disciplines. For skeletal dysplasia, for instance,
we need a team of doctors that include clinical geneticists, orthopedic surgeons, local scientists, to understand the meaning of the genetic change just specifically for one patient. And of course, X-ray doctors, radiologists, the nurse, the medical social workers, the speech therapist, the occupational therapist, the physiotherapist.
Maddie has been doing therapy to correct her speech delay for a year now.
When we give it to octopus, we need to say, here you go. With a sound, remember? Here. Here. Yeah. Very good, nice her sound. Again, here. Yeah. Sophia with a nice.
She was born with a cleft palate, now fixed by surgery.
Before that, she wasn't saying much. So at first, I started to help her using words to communicate, maybe starting from one word like me or give or put. And then now that she's saying a lot of long sentences, which colored ball would you want?
Yellow.
Okay, the whole sentence?
Yellow, please.
Okay, very good. You want yellow, please. Progress, and she is now a chatterbox at home. That's a casserole. And she's asking all sorts of different questions. Parcel.
Loosen up the neck a little bit.
Nicole is doing Pilates to prepare her for the big day in December.
So it's normal to have an increased curve here, especially in pregnancy.
She's 34 weeks pregnant.
I know the pregnancy with the Pilates, I'm a lot stronger.
The heartbeat. These are the four fingers here, and that's the thumb sticking out of the back.
Yeah. This is one of the most indicative things about diastrophic dysplasia.
Her fetus, a girl, also has dystrophic dysplasia.
I knew even before falling pregnant with this child that people could potentially call it irresponsible of us or selfish, or people couldn't find fault in it because we are knowingly going into a pregnancy knowing that this child could be affected by the same disability. I think it's a positive thing for Maddie to have a sibling with the same condition. For children with rare diseases, they could grow up their entire life not ever meeting someone with the same condition.
Maddie's likely to use a wheelchair as she ages, but her life expectancy is normal. Her parents hope she'll have a family of her own and a career.
Watching her do things that even I didn't expect that she would be able to do, it gives me a lot of hope for the future.
Up next, after the break, little people in a world beyond their reach.
They will have difficulty climbing stairs, going to public toilets. So what we do is we try to lengthen their bone.
Painful process for them.
We will let him decide.
As if I hadn't done the surgery, I would feel more regret.
Stay with us.